Welcome to The Bleeding Edge, a Glanzmann Thrombasthenia podcast produced by Believe Limited and Bloodstream Media and made possible thanks to our presenting sponsor, Hemab Therapeutics. I'm your host, Patrick James Lynch, reminding you that the following information is for educational and informational purposes only. Please speak with a healthcare professional before making any healthcare decisions. In the first episode, we talked about patterns, how bleeding starts early, how it repeats, how over time it becomes something people learn to live with. But most of that conversation focused on what happens during a bleed, the moment itself. What we didn't really get into is everything that happens in between. Because with Glanzmann Thrombasthenia, the impact of bleeding is not always measured by what happens in the moment. Sometimes it's measured by what the body carries afterward. And sometimes it's measured by everything a person changes, avoids, or prepares because of it. That is where a lot of the impact actually lives. It's not just the event, it's what carries forward after it. When we talk about invisible impact in bleeding disorders, the story doesn't always start in a clinic. Sometimes it starts in family history, in language that predates diagnosis. This is caregiver Stacey McKeown.
Even my granny, who's 94, who's still alive, I don't know if she's a carrier. My mum or dad are a carrier. She could be a carrier. But whenever I chatted to her about Rua's special blood, and she was telling me, back in the day, she was always a fainter. She had multiple miscarriages, always a bleeder, always anemic. And she said back in the day, women were just called bleeders or bruisers. You were just a bleeder or a bruiser. That's just the way some women were. When they give birth, they died because they bled that much, or they had really heavy periods, they had loads of miscarriages. They were always anemic. They always had a bruise like a peach. I bruise like a peach. And that's my granny. That's the way she's done. She's lived her whole life, so she's done well. But that's the way it was. Back then was just, you're just a bit of a bleeder or a bruiser. And it's came on, but still not massively, and even in primary care, they still don't fully understand what heavy bleeding is or bruising is, and what it actually means. It's what it's actually doing in your body.
What Stacey is describing is not just family history. It's a pattern of symptoms that existed long before there was a name for them. Bleeder or bruiser wasn't a medical category. It was a placeholder for something not yet understood. And while that language feels distant, the underlying pattern isn't. Because even today, how bleeding is described still influences how it's interpreted. And that gap between description and significance is something that continues to appear in Glanzmann Thrombasthenia research, including qualitative findings from studies like the GT360 study, which explored the lived experiences of people navigating this condition. To help unpack what that looks like, we turn to the person who led the GT360 effort, Dr. Kate Kerr.
I think what happens in people with Glanzmann's is they bleed a little bit today and they bleed a little bit tomorrow and the next day and the next day. And then their hemoglobin just drifts ever so slowly down to levels where if you were in a car accident and you bled a lot, you would be being transfused because that's how low your hemoglobin is.
The challenge is that this kind of impact can be easy to miss. There may not be one dramatic moment where everything changes. Instead, small losses accumulate over time. The impact begins to show up in the body through depletion, often quietly. And the protein ferritin, along with iron, have central roles to play in all of this. Lifespan hematologist Dr. Sutesh Sivapalaratnam explains.
Ferritin and iron are so important because a few things. Obviously, they're part of the building block of red blood cells, which you need for oxygen transport, but it also is built in all other tissues. So you kind of need iron for multiple reasons. So for instance, if you were chronically anemic, that could, for instance, affect your heart function, to say one thing, obviously brain fog. There are a lot of things that can be a result of that. And also, interestingly, it is thought that anemia itself can also aggravate bleeding.
But laboratory values only tell part of the story. The other part is what happens when someone has lived with those symptoms for so long that they no longer recognize them as symptoms.
I've been anemic for my entire life, basically. It's been my status quo.
This is Quinn, a person living with GT.
There's been times where, one time my hemoglobin went down to 5.4 and I didn't notice. I just thought I was depressed or sleepy.
For context, generally speaking, any adult with a hemoglobin level below 8 is considered to have severe anemia.
I was critically low, and they got my test results back, and they told me to come in immediately to get red blood cells. And it's just something that I've been so used to for so long that I can't really tell when I get super anemic because I'm just always anemic.
Quinn's experience aligns with a pattern seen in both clinical literature and patient-reported outcomes data. And what Quinn describes is what happens when chronic iron loss stops registering as change. It becomes the default, not because the body has adapted, but because the reference point has shifted. That's a shift that shows up not only in lab values or fatigue scores, but also in how people interpret their own bodies over time.
I was very, very anemic.
This is Eliza, a patient advocate who we met in episode 1.
I was having a really tough time making it through my day, and then the multiple hormonal therapies and treatments being thrown at me really affected my mental health.
The fatigue can also come from just managing.
Alexandra is a mom to 2 boys with GT.
Like being woken up by a nosebleed, or having this bruise that is like really tender right now, or these growing pains that seem to be on the more intense side of the scale. And so I think there can also just be like some emotional fatigue.
Fatigue in Glanzmann thrombasthenia is not always tied to one single cause. It can reflect ongoing blood loss, iron depletion, disrupted sleep, and the emotional effort of responding to unpredictable bleeding. These challenges have also been explored in educational resources like the Management of Glanzmann's Thrombasthenia webinar from the National Bleeding Disorders Foundation in the USA, which you can find in the program notes for this episode. And speaking of resources to help the community, I'd like to take a moment to tell you a bit about the Bleeding Edge's presenting sponsor, Hemab Therapeutics. For people living with Glanzmann thrombasthenia, or GT, bleeding can affect far more than physical health. It can shape daily life, independence, and everyday peace of mind. Despite the lifelong burden GT places on patients and families, there remains a substantial unmet need for preventative treatment options. Guided by the belief that all patients matter, Hemab is focused on advancing research for serious and underserved bleeding disorders, including GT. One investigational therapy that Hemab Therapeutics is studying is sutasamig, a potential prophylactic treatment for people living with GT. Sutasamig is currently being studied in clinical trials and has not been approved by any regulatory authority for use outside of clinical studies. To learn more about Hemab Therapeutics, Glanzmann thrombasthenia, and the ongoing research into sutasamig, visit hemab.com. That's HEMAB.com. Now, back to the bleeding edge. Even with the same diagnosis, the pattern of bleeding can look very different from one person with GT to the next. And that variability creates another challenge. There is no single picture of what Glanzmann thrombasthenia looks like. Some people experience frequent visible bleeding. Others experience symptoms that are harder to recognize. But across experiences, for better or worse, one theme remains consistent. People learn to adapt. I'd like to turn now to my co-host, Amy Owen-Wyard. Hi, Amy. How are you?
Hi, I'm good, thank you.
So, Amy, we're talking now about adaptation. Because of Glanzmann's thrombasthenia, what are some examples of how your family has learned to adapt?
So I think this question's really difficult to answer because if we're looking at it from a perspective of just Logan, then we've had to adapt in going to hospital, in managing finances, in managing lots of various other things that only I would know are different because I've got an older child, which is why I kind of said I find this really hard to answer. But I would say we've had to learn to adapt in that my oldest son has become a caregiver at a young age when he was 10. My younger daughter, she knows no different because she's the youngest, but she's had to learn to adapt with having mummy and daddy dipping in and out, and going to hospital. We've had to adapt how we work, how we live. So in terms of work, I've had to give up my professional career as a nurse and change into self-employment to be able to actually meet the needs and the crisis moments of Glanzmann's. My husband has had to, he's self-employed, but he's had to come out of work. So on Friday, for example, Logan had a major nosebleed and he spent the whole of Friday through to Sunday in hospital whilst I stayed at home with our other child or children. And then from Logan's perspective, we've had to adapt a lot for him in terms of he's not been able to go into state school education. He's had to go into private education. He has to go to hospital. He has to have video calls with his family, with his friends, with school. So there's lots of adaptations that we've made because of Glanzmann specifically. All of that said, we don't stop him from doing anything, and I can't put enough emphasis on the fact that we just let him be a normal child, but in inverted commas. But I think that's because we've got that older child. We know what he can do and we'll push the boundaries with him.
Right. That gives some helpful context. Well, that certainly is a lot of adaptation. I appreciate that walkthrough, Amy. Don't go far. We're going to come back to you in just a couple of minutes, but I want to now turn to Kate Kerr. She highlights how people with GT tend to demonstrate different types of bleeding patterns.
Some bleed a lot, some seem not to bleed quite so much, and nobody really quite knows why that is. There might be some differences in genetic mutations that cause a slightly more severe or less severe form of Glanzmann's. In childhood, you can see if you're falling over a lot, you're more likely to get bruises, you're more likely perhaps to have joint bleeds, which if you, again, read the textbooks, don't happen in Glanzmann's, but I can assure you they do.
That quick comment, I can assure you that joint bleeds happen in Glanzmann's, harkens back to something we covered in episode 1, the fundamental disagreements amongst medical professionals about what an actual bleeding event in Glanzmann's is in the first place.
So we've had definitely plenty of nosebleeds that go on for days at a time, sometimes up to a couple weeks, like stopping and starting.
Connor cares for a young daughter with GT.
We've had to keep her home for, out of school a couple days with that now that she's in school, just because it's just not, doesn't stop. It's kind of hard to be at school with that happening.
Most people, their nosebleeds can stop within 10 minutes with some pressure applied.
Caitlin is a person living with GT, using her lived experience every day while she's in med school.
Mine would usually require at least 30 minutes of pressure, and even then, about 90% of my nosebleeds require nasal packing.
For those unfamiliar, nasal packing is what it sounds like, filling the nasal cavity or cavities, often with a small compressed sponge that expands to apply pressure and stop bleeding. But in many cases, not even that is enough.
And I want to say 30 to 40% required hospitalization and at least a trip to the ER for professional packing by ENT.
What Caitlin is describing is not just adaptation. It's expertise, built from experience, learning not only what a bleed is, but how different bleeds behave.
Sometimes they seem small, but they just won't stop. Sometimes they're gushing and it's an alarming amount at once, but they're easier to stop. So I would say we've just gotten more experience with all different types of them. They usually happen when he's sleeping. So it's usually like a 1 or 2 or 3 a.m. start to a nosebleed. So I think we're just a little bit more prepared, but you still don't know if that light nosebleed just might be really stubborn.
What Caitlin, Connor, and Alexandra's experiences illustrate is that unpredictability in GT is not limited to the in-the-moment intensity of a bleed event. Timing and reoccurrence can be quite disruptive forces themselves, especially when bleeding interrupts rest and recovery cycles. But before someone can start to learn to recognize characteristics such as GT's unpredictability, there's often another more fundamental challenge that patients and caregivers face, and we hinted at it at the top with Stacy's story about her grandmother. That is getting a diagnosis in the first place.
Kids always look a little different when they're born, right? So it's kind of hard to tell. So they didn't really make too much note of it at the time. We kind of pointed it out and was like, is that normal? They're like, oh yeah, it's fine. She was just born. Give it a little while.
Connor recalls noticing what appeared to be signs of bleeding on his daughter just after her birth.
They do the heel stick, and then the nurse came back, 20, 30 minutes later, and it was still bleeding. And she's like, oh, that's weird. It kind of bled through the Band-Aid, bled into the, bedding area. And they're like, we should get that kind of checked out, and so they did transfer her to the NICU, but she was in the NICU for 5 days after she was born, kind of getting all that figured out. And we're like, what caused this? They said, we don't know. Everything looks normal, because in Glanzmann's, your blood panels look pretty much normal. You're not going to pick it up. You're not going to see a low platelet count or, like anything, other than that she was anemic. They knew she'd lost blood, but they didn't know why.
To Connor's point, because GT is a disorder of the platelet's function and not the platelet count or appearance, routine lab tests generally won't lead to a diagnosis.
I think they tested for a few things. I think they ruled out von Willebrand. They ruled out a few things, and they were like, well, we don't know. And then they sent us home and follow up with the pediatrician later on. And so we didn't actually get a diagnosis until she was just about a year old. 11 months old is when we kind of finally got the GT diagnosis.
Of course, once diagnosed, there are new complexities to face and challenges to solve, including what may be one of the most underappreciated downstream effects of chronic bleeding, which we've already started to speak about on this episode: iron depletion.
Some days I was in, so much fatigue and mental fog, and I couldn't even remember how many pads I'd gone through.
Eliza recounts the importance of documenting her experience, especially while experiencing fatigue and mental fog.
That information was really important for me to record, especially since I would go to my doctor's office, and since I was so anemic, I had such terrible brain fog. I couldn't articulate what I was going through. So the journal was very helpful for me to say, this is what I'm experiencing, this is how many products I'm going through, this is the medication you prescribed, I've stayed on target, it's not helping or it is helping.
I was still feeling all of the same symptoms of anemia, like fatigue, restless legs, craving random substances.
Caitlin recalls learning about the impact of iron deficiency.
And just having to nap all the time, dizziness, lightheadedness, everything. And I wasn't really sure why, because my hemoglobin was normal at the time. But then I learned that iron deficiency on its own can cause all these symptoms as well. And so I started getting my iron checked regularly and then advocating for iron infusions, which my healthcare providers were happy to give.
For some people with chronic bleeding disorders like GT, iron infusions become part of routine care to mitigate the impact of iron depletion caused by bleeding.
And I received 2. I felt so much better. And so now I'm more in tune to those symptoms. When they come up, I'm like, okay, this is a clue that even though I'm not bleeding overtly as I used to, my iron levels might be a little bit low. So I'll get those checked and then I'll go for another infusion. And that's kind of how I would say I've been definitely more in tune with my symptoms and management.
Some patients with low iron will first be placed on an oral iron therapy before being escalated to iron infusions. Such was the case for Eliza.
So after a few weeks of being on the oral iron therapy, I went to my doctor and I said, this really isn't working for me. I'm having all these side effects, which is pretty common, and I know there's better options, so what can you do for me? And at that point, he was willing to prescribe me an iron infusion. I went in for the infusion, and within a few days, I felt like $1 million. It was night and day. I felt like it's kind of interesting to realize, this is what it feels like to be normal. But after being anemic for so long, I was like, I feel like I can do anything. So it was amazing.
This is what it feels like to be normal. I feel like I can do anything. It was amazing. Eliza and Caitlin use some strong language to describe the difference they felt before and after iron infusions, which leads to a question. How many patients with Glanzmann thrombocythemia are also dealing with the impact of chronically low iron levels?
How many patients with Glanzmann have iron deficiency? We don't really know that.
This is Dr. Guy Young, pediatric hematologist and researcher.
But as we're now measuring levels of iron in the blood, we're finding a lot of patients with Glanzmann thrombocythemia who are not anemic, but have low iron. And the low iron is problematic because they can still have symptoms similar to anemia, being tired and other symptoms. There's actually, believe it or not, restless legs is a symptom of iron deficiency. It's weird. We don't know exactly how it's all connected, but yeah, patients who are iron deficient, even if they're not anemic, can have symptoms that impact their quality of life. And what we're learning is that if we fix the iron deficiency, we can actually fix the symptoms.
This is probably a good moment to pause and clarify an important distinction, and that is the difference between iron deficiency and anemia.
So anemia is the far end of the spectrum. That's when you've already lost a lot of iron, and now you have so little iron, you're actually losing blood cells. You don't have enough blood cells circulating. The tip of the iceberg is the iron deficiency. We want to get to the iron deficiency before we end up with anemia. Maybe I should say the iceberg is the iron deficiency, and the anemia is the Titanic. So we don't want to get to a point where the ship is sinking.
But wouldn't the blood loss leading to such iron depletion be more obvious?
There's probably blood loss that's happening on a microscopic level in the nose, in the mouth, in the intestinal tract, where blood is being lost without knowing about it. So bleeding that's not obvious. We call it occult bleeding. You don't see it. It's not symptomatic. However, can result in a draining of iron from the body, which can then give you symptoms.
And so when you have a lot of bleeding episodes, if you have a lot of nosebleeds, you have a lot of bleeding in the GI tract, you become iron deficient, right?
Dr. Mira Chitler is a Michigan-based pediatric hematologist and medical center director.
That has its own implications, right? This is a child or an adult who's constantly tired. Okay, it's hard. Yes, we can identify iron deficiency, we can try to treat it, but when you're constantly bleeding, sometimes it's hard to keep up with it.
And the data says patients with Glanzmann thrombocythemia, generally speaking, are indeed constantly bleeding. According to Dr. Kerr's Glanzmann's 360 study, patients and caregivers are reporting, on average, 3.5 bleeds per week. That's over 180 bleeds per year, on average. No wonder patients are turning up iron deficient.
So I think that's an area that we really need to investigate more by studying patients with Glanzmann thrombocythemia and measuring the iron in their blood. And I think we're going to find a lot of patients who are iron deficient who've been having symptoms that were just kind of vague. I'm a little tired and I don't sleep that well and I get these cramps in my legs. And then you treat them with iron and voila, these kind of vague and maybe a little bit strange symptoms all of a sudden go away.
The relationship between GT, iron deficiency, and anemia is clearly an area in need of further study. Amy, I want to bring you in again. Given some of your personal experiences, along with your research work into GT, I'm wondering how you think about the role of managing iron deficiency within the context of managing GT.
From a personal experience, I don't think that, and I'm going to criticise professionals, but I don't think professionals that are involved in Logan's care specifically acknowledge iron deficiency. So Logan has spent most of his life iron deficient anemia. And it took for my husband last year to actually ask when was the last time he was within range for them to sit back and reflect. Actually, he's not been in range bar twice in his whole entire life, but nobody had actually done anything to address the iron deficiency or even noticed it was a thing. So I don't think that professionals necessarily put the two together and think, how is this impacting this child? I spoke to a nurse from a different comprehensive care centre and asked how they manage their Glanzmann's patients, and she said that they regularly give iron transfusions dependent upon the need. So then I went back to Logan Centre, said this and put them into contact, and now he has 6 monthly iron transfusions to help with that anemia. That said, he's still permanently anemic. So I don't think that there's enough protocols or policies in place to manage iron deficiency anemia that go across the globe. From our research, from what we've experienced from the interviews, a lot of males are iron deficient and they're not aware until their hemoglobin is in its boots. And they're not getting the regular checks that maybe women are getting because of having their periods. When we were at World Fed, there was a conversation around iron deficiency in women, and it gave a lot of symptoms that actually they forgot men again. And I think men are maybe overlooked because of the care in haemophilia. And again, I say this in inverted commas, being so excellent that they assume boys are served.
Well, those are really valuable insights, Amy, and I want to commend you for your advocacy work in finding out what another comprehensive care center was doing and that influencing the protocol for Logan. That's a good example of advocacy in action and the value of seeking a second opinion as well. And you'll hear more on this topic of iron deficiency in Glanzmann's thrombasthenia in that Management of Glanzmann's Thrombasthenia webinar that I mentioned earlier, linked in the program notes.
I think also the other thing that we really underestimate is the worries and concerns people have about like bruises, because a lot of people are, oh, it's just bruises, but it's not, because what I've heard is like that bruise which prevents someone from wearing shorts. If people want to wear shorts, they should be able to wear shorts. Or that bruise where people kind of look funny at someone is something happening which is causing that bruises? Are they being mistreated? And I've heard that can be really difficult.
Whispers about physical abuse or self-harm can start when a person presents with such obvious bruises.
And so, this can really affect their quality of life. So there's a medical component to this, but also a serious quality of life component to this as well.
Again, the GT360 study highlights that quality of life scores are meaningfully reduced. And notably, about half of the study's respondents showed some signs of depression, underscoring the wide-ranging effects that a GT diagnosis can have. To Dr. Chitler's point, one area that has both medical and quality of life considerations is the experience of going through puberty as a person with GT, particularly for girls.
We are learning more and more about how severe periods can be or period bleeding can be in these patients. It's not very well described, but it is thought to be a mucous it is a mucous membrane. The lining inside the uterus is a mucous membrane. So as with any other mucous membrane, that can also be severe bleeding. Okay, but the exact incidence or how many girls with Glanzmann's actually have heavy periods, I don't think we have that data very clearly.
Some data that we do have comes from the GT360 study, which conducted interviews with 11 women with GT. Of the 11, all 11 reported heavy menstrual bleeding, with one respondent sharing that her first period lasted months.
What is the best management for these patients? What is the best thing to do? How do you take care of them, right? That kind of information is missing.
And why is that kind of information missing? So far, we've heard about bleeding that isn't always visible, sometimes because it happens gradually, sometimes because it becomes routine, but sometimes the bleeding is visible and gets dismissed or minimized anyway. And sometimes information is missing, not because it's hard to come by, but because those in charge didn't think to ask for it.
We've seen sexism in medicine all throughout history. Huge trials with only men, ignoring, even things like menopause. I mean, there's very few treatments for that these days. So I think there's clearly sexism in medicine in that regards.
Glanzmann's affects girls and boys equally in terms of the numbers of people who have it. But obviously, if you're a girl / young woman, when you start having periods, you're much more affected than your similar aged male counterpart.
When someone goes to the GP as a woman with bruises or bleeding, it's put down to a female issue. It could be something to do with your hormones, something to do with your period, something to do with your cycle, and it is normally put down to a female dominant issue. Where when a man or male goes into the GP with bruising or bleeding, they get bloods done and they're referred to haematology, because that is not normal for a man to have such issues. So You know, there's definitely we hear these types of stories time and time again. So yeah, there's definitely still that bias, definitely. There's still the stigma, but I also think there's a lot of self-stigma within women as well, that we need to work on. So it's not just the healthcare professionals. I think women also believe from their parents and from their grandparents that you just have to get on with this heavy bleeding, you know, and you just have to get on with this bruising. So there's a lot of self-stigma, and you have to get up and go to school with your period because that's what your granny did, and that's what your great granny did. And everybody has a miscarriage, and everybody just gets on with it, and everybody bruises, and you just have to get up. So there's a lot of cultural stigma with it as well. So it's not just healthcare professionals, it's a cultural thing that we have to really work on, that it's not okay to bleed. It's not okay to have heavy periods.
When she, goes through puberty, starts getting her menstrual cycle, all that's going to be a whole nother ball of wax in every category for her, including the anemia. So we'll just have to kind of cross that bridge when we come to it.
My periods were never trackable, so it was kind of just whenever it would come. And then I do think it's kind of a shared experience with a lot of women and girls with their first few periods, like not exactly knowing how to manage it well, with leakage and things like that. Mine just happened to be a little bit heavier because of my bleeding disorder.
I was around 15 years old. I was already kind of a late bloomer and already felt like a little bit out of the norm. Me and my mom, we had walked through what it would look like and what kind of treatment I would need. So I was very prepared that when this happened, it would be kind of a scary time, and just kind of looking up against it. I bled every single day for around 3 months straight of just passing large clots and soaking pads and just the works.
Put yourself in Eliza's lived experience for a moment. Bleeding every single day for 3 months straight. Imagine the impact on life.
I was keeping a journal during this time to record my treatments and how many pads I was going through and such. I had a lot of mental health challenges during that time.
For the girls that start their periods, there are medicines that can be given as tablets, so like tranexamic acid or aminochloroic acid, which makes the clot stronger once you've made a clot and can help with bleeding, but then also might mean that you have clots in your menstrual cycle, so that you're then having to pass the clot as well as bleeding, which is obviously painful and unpleasant for the girls. And more often than not, what happens is to try to reduce the amount of days that you bleed for and to be more kind of focused on when you are going to bleed, is that girls get put onto oral contraceptive pill as a hormone replacement therapy to try and reduce their menstrual cycle, not as contraception. And that can be helpful for some, but obviously isn't helpful for everybody, and also comes with side effects.
Girls and boys, women and men, patients and caregivers all experience the burden of Glanzmann thrombasthenia differently. And the data and anecdotes validate that the burden is very real. However, as we begin to wrap up this episode, it's important to stress that life with GT can still be beautiful, fantastic, dynamic. Caitlin Lee is a bright example of just that.
Your Glanzmann's is a part of you, but it does not define you. It cannot tell you what you can and can't do. You get to decide that for yourself. And it doesn't have to limit you. You can do whatever you want. You can be whatever you want. I went to undergrad away from home. I travel a lot now. I'm doing all these sports that I never got to do before. I'm now surfing, diving, all of this great stuff. And even if you think that maybe that's out of reach for you, I want you to look at the future. There's always a little bit of hope, and there's a great community out there, people with Glanzmann's out there who'd be willing to reach out, be a part of your life as well. So you're not alone.
You are not alone. In fact, the Glanzmann Thrombasthenia support group on Facebook has over 1,000 users waiting to welcome new members to the community. Take a look at the links in the program notes for more. Throughout this episode, we've heard about bleeding that isn't always obvious. Sometimes because it happens slowly and sometimes because it's routine. And sometimes because the effort required to live with it becomes so familiar that other people never see it at all. We talked about fatigue, iron deficiency, unpredictability, the burden of repeated appointments, missed school, interrupted sleep, and decisions that have to be made over and over again. Much of that work never appears in a medical chart, but it is work nonetheless. And for many people living with GT, that work doesn't happen occasionally. It happens every single day. And that is where we are going next. In our next episode, we'll explore what happens when all those moments begin to add up. The planning, the preparing, the interruptions, the decisions made before leaving the house, before going to school, before saying yes to an invitation, or before getting a good night's sleep. It's the invisible work that surrounds every visible bleed. We call it the effort tax. Join us for episode 3 of The Bleeding Edge, where we'll explore how living with Glanzmann thrombasthenia can shape not only what people do, but how they think, plan, adapt, and move through everyday life. We've included links in today's show notes to the research and educational resources highlighted throughout this episode, including the GT360 study and the Management of Glanzmann Thrombosemia webinar. To learn more about community resources, research opportunities, and ways to get involved, visit bloodstreammedia.com/the-bleeding-edge. The Bleeding Edge is produced by Believe Limited and Bloodstream Media and made possible thanks to our presenting sponsor, Hemab Therapeutics. Learn more about Hemab's research and dedication to the GT community by visiting hemab.com. Please subscribe to The Bleeding Edge wherever you get your podcasts and share this episode with someone you think could benefit from it. We'll be back next month with another powerful episode. I'm your host, Patrick James Lynch. On behalf of my co-host, Amy Owen-Wyard, and everyone working behind the scenes, thanks for listening to The Bleeding Edge, a Glanzmann Thrombasthenia podcast.